My name is Afan Anis and I'm from Pakistan. Earlier this year, I was diagnosed with Fuchs endothelial dystrophy. There was a certain cloudiness and a haze that was impeding my vision at short ranges and at distant ranges. As a result of which, I wasn't able to watch any television, text messages, drive, basically impeded daily life on a day-to-day basis.
Afan has a condition called Fuchs dystrophy. This condition affects the inner lining of the cornea, which is the front window of the eye, while the outer lining is completely normal. The condition causes gradual decrease of vision over years and years, and if it's left untreated, eventually causes the vision to be extremely poor or legally blind.
Doctors advised that there was no possible surgery or treatment to fix this in Pakistan. And after that, I started researching on the internet on what treatments were available abroad. And I came across Moorfields and Dr. Ismail Arbabi in particular, whom I thought regionally was the best option available for myself.
The treatment for it is a type of corneal transplant. But in Afan's case, because it's only the inner part of the cornea is affected, instead of doing a full thickness corneal transplant, we only do what we call a DMEK or partial corneal transplant. In this type of transplant, we only replace the inner lining of the cornea while leaving the outer lining of the cornea completely intact.
After coming to Moorfields and meeting with Dr. Arbabi, I went through a large number of tests that were done here, most of which were not available in Pakistan. After the tests were analyzed by Dr. Ismail, we decided on the first surgery for the left eye.
And by doing this, there are many advantages the DMEK has over the traditional full thickness corneal transplant. Firstly, the visual recovery is extremely fast, and patient can expect to see 20/20 or 6/6 within a matter of a few weeks, usually between 1 to 4 weeks' time. Second advantage is that the risk of corneal rejection is very low with DMEK corneal transplant. In fact, the risk of rejection is less than 3%. And thirdly, patients often with most other type of corneal transplant, they may need subsequent surgeries to improve the vision, usually removing corneal sutures, and patients may require further laser. Whereas with the DMEK transplant, it's a one-time procedure. You do it once and usually they do not require any further procedure.
After the surgery, within 2 weeks, I started getting my vision back. The new vision, as I now call it, was in stark comparison by leaps and bounds better than what I had been with the last 4 years or so. The colors, the contrasting images, the sharpness was an absolute experience. It was like getting a new set of eyes. And that exact same thing happened with the second eye. Within 2 weeks, vision was so much better. So the experience of getting my vision restored has been phenomenal. Ever since I've come to Moorfields, it's been a life-changing experience. From the reception staff, to the nurses, to the surgical staff, to the doctor, to the staff that scheduled my appointments. I'm very thankful to each and every one of them. I'm grateful for them to have given me a new lease on life to be able to see once again.